Hello, everyone, and welcome back to The Explainer. Today, we're diving into a genuinely huge development in Delhi's urban public health landscape. A thriving city absolutely relies on the rock-solid foundation of its healthcare system, right? Because if the citizens aren't healthy, well, the city simply can't move forward. So, in this explainer, we're breaking down a massive new announcement that's set to drastically alter the region's medical infrastructure. We're going to explore exactly what it means when substantial resources are poured directly into a brand new facility, and how a decision like that ripples out to affect everyday care for millions of us.
Okay, let's dive into this. It's super easy to talk about public health in the abstract, just throwing around policies, theories, and health guidelines. But the reality? The future of care is always built on tangible physical infrastructure. How do massive capital investments actually shape our local communities and dictate access to vital care? Think about it. When a government commits to building a sprawling facility completely from scratch, it's essentially making a concrete statement of intent. They're literally using bricks, mortar, and state-of-the-art equipment to physically bridge the gap between abstract policy and the actual patient. It's a real game changer that shifts the conversation entirely from what should be done to what absolutely can be done.
And that brings us directly to the official reveal. Delhi Chief Minister Rekha Gupta has just announced a major healthcare infrastructure boost. This is a high-level, incredibly targeted initiative designed to inject a massive amount of developmental energy straight into the public health system. We aren't just talking about patching a roof on a local clinic here, or bumping up a standard operating budget by a tiny fraction. No, this is a top-down directive aimed at fundamentally expanding the city's overall capacity to heal, to teach, and to operate at a much, much higher clinical level.
Now, what's really interesting about this slide is the sheer scale of the financial commitment here, 805.99 crore rupees. Let that sink in for a second. It's the kind of number that immediately demands your attention, because you certainly don't just find that kind of capital hiding in the sofa cushions. Allocating over 800 crore to a single initiative represents a truly monumental shift in resources. It signals a move far, far beyond just providing basic daily care, and steps firmly into the territory of long-term structural transformation. When investments reach this absolute top tier, they're deliberately designed to not only meet the demands of today's population, but to anticipate the heavy healthcare burdens of the coming decades.
So, the crucial point is, when we piece this blueprint together, the true scope of the vision really becomes clear. With Chief Minister Rekha Gupta leading the charge, this 805 crore project isn't just another standard hospital. Actually, it's a brand new medical college located in Dwarka. And guys, that distinction is incredibly important. A medical college acts as an institution of higher learning, right? It's a rigorous training ground for future doctors and a primary hub for continuous medical advancement. It means the facility won't just consume medical talent, it will actively produce it. It's like a perpetual engine, continuously feeding highly trained professionals right back into the broader healthcare ecosystem.
Let's move to and see how this builds the location as a true destination. By choosing Dwarka, the initiative positions the area as a new, highly centralized anchor for medical professionals and patients alike. It completely transforms Dwarka from just another residential point on the map into an epicenter, a place where hundreds of crores are flowing to unite health and education in one specific region. Concentrating these kinds of heavy-hitting resources creates this massive gravitational pull for top-tier medical talent and specialized technology. It basically ensures that residents in the vicinity won't have to cross the entire city for advanced procedures, fundamentally shifting the entire healthcare geography of Delhi itself.
And this brilliantly illustrates exactly what we're talking about today. The announcement itself explicitly calls this a major boost to healthcare infrastructure. And when we zoom out, well, we can see exactly why that phrasing hits the nail on the head. A medical college inherently multiplies a city's capabilities. It means training the next generation of healthcare workers, aggressively increasing the immediate capacity to treat an influx of patients, and fundamentally raising the baseline of what the local infrastructure can handle during any kind of major health crisis. It's an investment that pays huge dividends, not just in the number of beds and waiting rooms, but in the actual institutional knowledge of the city's entire medical workforce.
As we wrap up today's explainer, I really want to leave you all with this thought. With this massive influx of capital to build a new medical college entirely from the ground up, how will this infrastructure boost reshape the daily reality of local healthcare for the citizens of Delhi? It's a structural investment that promises to leave a lasting footprint for generations, permanently shifting how care is delivered and exactly who is trained to deliver it. So, what does this all mean for the future? We'll have to wait and see. Thank you so much for joining me to break down these facts today.
Keep asking those great questions, and I highly encourage you to keep a close eye on how this fascinating project develops.